Miss Hilda. I'm one of the PAs working at the clinic today. Do you mind just confirming your name and date of birth for me?
Hi, I'm Izzy Stevens. My date of birth is 6/12/2001.
It's nice to meet you, Mrs. Stevens. I understand you're here for vaginal bleeding and a positive pregnancy test. Before you begin, were there any other concerns that you had?
No other concerns.
And who do we have here with us today?
I'm her boyfriend.
It's nice to meet you. Usually I prefer to speak privately with patients one-on-one when discussing sensitive topics such as pregnancy. Do you mind stepping out for a bit? It'll be a few minutes.
She's fine here with me being here, okay?
Oh, okay. Ms. Stevens, what do you think?
It's fine.
Okay. All right then, I guess we'll get started. So my first question to you is, when did the bleeding start?
Yesterday?
Okay. Have you stopped bleeding since then?
No.
Oh, all right. Do you know how many pads you've gone through or tampons that you've gone through?
5 or 6, I guess.
Okay. All right. So now I'm gonna do the physical exam. I will need you to step out while I'm doing the physical exam because it includes a pelvic exam. And as per our policy, we need you to step out just to respect the patient's privacy. It shouldn't take more than 10 minutes, including setup.
I mean, it's nothing I've ever seen before. I think I'll stay here. Yeah.
You know, I understand that and I really appreciate the support, but the exam is sensitive to begin with, and it can be kind of uncomfortable for patients to have done, especially in front of loved ones. This is something to do for all patients, you know, per our policy, just to respect their privacy. Thank you for being patient.
All right, I guess I'll be outside.
Okay, thank you. It'll be just a few minutes. Okay, before we begin the physical exam, I just forgot to ask a few questions. First off, how are you feeling?
I'm fine. It's not like the other, first time I've miscarried. I just feel like a little stressed, that's all. I mean, Mark, he means well, but, you know, he just has high expectations, you know? And I don't know, I figured a baby would maybe bring a little bit of happiness to our lives.
Yeah, of course, that's totally understandable. We'll do an ultrasound after this, just to kind of better understand what's going on, so you have some more answers, all right?
Thank you.
And one last thing before I forget, we ask all our patients this question. It's routine. It helps us to kind of ensure that you're getting the support that you need during this process. Is it okay if I ask them?
Sure.
Okay, the first question is, do you feel safe in your relationship right now?
What does that have to do with any of this?
These are just routine questions. You don't have to answer them if you don't want to. They're just here to help us help you if needed.
Oh, okay, I mean, yeah, I guess I feel safe.
Okay. The second question, does anyone try to control where you go, who you talk to, or what decisions you make about your body or health?
I mean, Mark does sometimes, but that's just because he wants, you know, what's best for me. And he's my boyfriend, and I want to make him happy, and it's not like I have a preference or opinion anyway.
Okay. Yeah. That makes sense. And the last question, you don't have to answer if you don't want to. Again, completely up to you, alright? Do you feel safe at home, even when there's conflict or tension?
Well, sometimes when he drinks too much, but with this baby, I'm hoping he'll turn around, you know?
Yeah. That can be sometimes difficult, so I just wanted to let you know that, you know, you have a right to feel safe and make your own decisions, especially regarding your body and health, and you deserve to be treated with kindness, you know?
I am. He loves me, and I'm going to have a baby with him, and everything will be fine, you know?
Thank you for being open with me. Just know that if there is, you know, God forbid, a time where your answer changes or you don't feel safe, just know that we're here for you, and it will stay private. You know, unless it's a direct to you or someone else's life, it will stay private and it'll stay confidential. But if anything does change, just know that we're here for you and we're here to listen, okay?
Thank you.
All right, now before we go back to the issue at hand, is there anything else that you had questions about or wanted to discuss?
No, I just hope my baby is okay.
Me too. Let's get you set up for the exam, all right? I'm gonna step out and have you change into this gown. I'm gonna ask that you kind of just be bare from the waist down. I'm gonna have my female medical assistant come back in the room when you're changed to help assist and chaperone the pelvic exam. Is that all right with you?
Yes, that's fine.
Okay, I'll be right back.
Thank you.